Sickle cell disease is a genetic blood disorder characterized by the presence of abnormal hemoglobin called hemoglobin S in red blood cells. In Uganda, as in many other parts of sub-Saharan Africa, sickle cell disease is a significant health concern, and it has a profound impact on the health and quality of life of individuals affected by the condition as well as on their caretakers. Helen Nalwanga and Monica Nachibuka are mothers to children with sickle cell disease. However, the two parents have experienced it differently. Nalwanga raised her two daughters single-handedly after her husband decided to abdicate his duties due to sickle cell disease.
My girl went to senior one. She got a terrible crisis where she had to get crutches. That's where the daddy ended giving support. I also said no. Now I can no longer stay with such a person who cannot support me with two children who are sicklers.
The journey to raising a sickler is not a cup of tea. Nalwanga says the social and emotional impact is distressing.
My community where I stay, they talk a lot. They actually talk a lot. But for me, I shut them down. And I tell them, these are children like other children. The only challenge is that this is a disease which nobody wanted.
On the day of our appointment, Nalwanga came along with her daughter, Tracy Katusime, who just completed her higher education. Katusime says living with sickle cell disease is an experience she wishes for no one.
When you're young, it's hard because you're under rules. But when you learn how to take care of yourself, it gets to be a better journey. Children these days go when there is hydroxyurea, but for us we start with only folic acid and fansida. But we are here.
On the other hand, Monica Nachibuka tells a harrowing story of her son's condition as a sickler who was once full of life.
When Moses made 5 years, he suffered stroke for the first time. His challenges became more complex because one of his body parts, his body sides wasn't functioning well. The left arm, left leg, the speech was a bit damaged or affected. So we had to do a lot of physiotherapy and pay more bills because we needed him to get back to normal functioning.
Currently, Moses' body functionality has reduced significantly, leaving him bedridden after suffering 3 strokes and multiple seizures.
And on the ward, it got worse. At some point, we just requested them for a referral, and they reminded us that Mulago does not refer. As a mother, I just told my child out of the hospital and whisked him away to IHK. He was later transferred to the ICU where he spent 1.5 months. I did not know what to expect anymore.
Both parents, despite the varying conditions of their children, say the non-communicable disease is very costly to manage.
Very big bills because Moses' conditions are now very complex. We don't do these small, and the first line antibiotics, no. His drugs are always the last line, the most expensive. You must always have money for Uber because he's now very tall. He's actually taller than me. So you cannot sit with him on a border or in a taxi.
Nalwanga still practices her profession as a teacher, while Nachibuka resorted to baking because it enables her work from home and provide the much-needed critical care for her son, Moses.
Now I do cakes for all functions from home, where I can go to the bedroom, peep and see if Moses is well, or tell someone, go and feed.
Nachibuka is well aware that her son's condition will not change anytime sooner or later, but her spirit is not broken.
We've tried to request different hospitals out there, abroad, to do a bone marrow transplant for him, and they say it is late, they can't. Then I'm requesting that the prices of drugs like hydroxyurea, which must be done every day, be lowered in reality, not just in the documents that we hear being read that it was lowered. Because when you walk to the pharmacies where we buy those drugs, they are still very expensive.
Daniel Odur, a sickle cell advocate, wants government to improve healthcare infrastructure to enhance the quality of life for individuals with sickle cell disease and their caretakers in Uganda.
We need massive testing because sometimes we even have challenges on stockouts of the testing kits.
He says increasing awareness about sickle cell disease within communities can help reduce stigma, promote early diagnosis, and improve the overall understanding of the challenges faced by those with the condition.
It looks like it's a neglected, non-communicable disease. So can we increase budget towards one, purchase of testing kits, awareness and sensitization throughout all sectors? To me, this would really help us a lot.
The United Nations Sustainable Development Goals emphasize non-communicable diseases as public health concerns, and sickle cell disease deserves recognition as a widespread disorder that can lead to serious morbidity, poor quality of life, and early mortality. Walter Mwesije, NTV.